a big announcement. The mayor will also give an update on where and when to be tested for the virus. He will discuss our COVID-19 test results, including an update on deaths. And the mayor will also give and discuss the work of our strike teams and other important details for your information. Mayor Buddy Dyer could not be here with us today, but we do have with us Dr. Raul Pino from the Florida Department of Health in Orange County to discuss details on the vaccination process as well as other important COVID-19 trending in our area. There's lots of information to share this afternoon. We're pleased asking you reporters be respectful of everyone's time. One question, please, when we get to the Q&A session. Both Dr. Pino and the mayor will be around afterwards for additional questions. That's what we have for now. And to begin our press conference, Mayor Demings. Mayor?
All right, good afternoon. Thank you, Dr. Williamson. We'll get right to it today. I want to start the briefing this afternoon with the good news before I tell you some bad news. Appointments for the COVID-19 vaccinations will reopen tomorrow morning at 8 a.m. for those ages 65 and older. We ask that you go to our website now and pre-register so that when the portal opens tomorrow morning, you will be able to obtain a date for your first and second vaccinations. Remember, this is for Florida residents only, and there are a limited number of appointments available, so most likely the portal will not be open for a long period of time tomorrow. To assist our older residents who do not have access to the internet or who are not comfortable with a computer, personnel will be standing by at 4 Orange County community centers. The workers will be able to help seniors register for the vaccine. The community centers that will have staff standing by are Holden Heights, Pine Hills, East Orange, and Taft. Again, Holden Heights, Pine Hills, East Orange, and Taft. There will be Spanish-speaking representatives available at the East Orange Community Center tomorrow. You can also call 311 to get information on any of these pandemic-related programs, 311. And now for the bad news. We have surpassed another grim pandemic milestone in Orange County. We have now passed 100,000 COVID-19 positive cases. That happened on Tuesday. Today, there are a reported 101,246 cases in our county. As Dr. Pino has mentioned numerous times, the coronavirus will continue to be deadly for some. The latest figures show 937 residents have died from the disease in our county. So we're getting close to 1,000. That is an increase of 42 individuals who lost their lives since Monday of this week. Here we are on Thursday. We live in a caring and a compassionate community, and our hearts remain heavy for those families and loved ones who have passed away. We continue these news briefings in an effort to curb these numbers. The vaccination site at the Orange County Convention Center has been busy this week, giving out the first and second doses of Moderna and Pfizer. Dr. Pino tells us that nearly 80,000 residents, to be precise, the numbers I've been given is 79,747 residents have received their first dose of the vaccine, and 17,862 residents have completed the second shot series. Those figures include the Convention Center vaccination site as well as those given by local hospitals. Paramedics from Orange County Fire Rescue and other paramedics here within our county are still going out to senior living communities to bring the vaccine to those who may not be able to get to the convention center. So far, paramedics have vaccinated over 2,300 seniors, including 269 elderly residents at Vista Del Lago, a community in the Winter Garden area from yesterday. For more information on about the vaccines, please go to ocfl.net/vaccine. In order to ensure our community receives timely information, we repeat some of the messages at our press conferences, and I'm going to do that again today. I want to repeat that our Barnett Park testing site will be open for at least another 4 weeks. Orange County Health Services personnel are there from 9 a.m. to 5 p.m. 7 days a week. Residents can get a rapid or antigen test, or a PCR test, or both, through February 28th. If you want information about testing, you can go to our website also at ocfl.net/testing. No appointments are necessary in order to get a test. We have tried to make certain that we hold our businesses accountable for complying with the facial covering order and other directives or guidelines. And our compliance or strike teams remain busy conducting inspections. Since early December, the teams have visited over 1,400 businesses and have issued 99 warnings and 17 citations. Overall, the teams have conducted over 7,900 inspections since August, with an overall compliance rate of 99%. That's pretty good. Now I'm going to share some new information with you. If you need a roof repair, this is new information. Habitat for Humanity of Greater Orlando and Osceola County is accepting applications for its roof repair program, which is a program that is funded by Orange County government's Community Development Block Grant. Residents who are interested in the program may visit habitatorlando.osceola.org/repair-my-roof. habitatorlando.osceola.org/repair-my-roof. And you can get more information about the roof repair program. And I want to remind everyone that the deadline to complete the community crime survey is this upcoming Sunday, January the 31st. The survey was designed by the Orange County Citizen Safety Task Force. It will be used to gather input from residents on solutions and strategies to prevent and reduce gun violence and violent crime. We have more than 1,800 responses so far, and there's a heat map behind me, I think. There we go. Okay. As they put up the screen, you will be able to see we have gotten the most responses from throughout the entire county. There we go. Residents can take the short survey by visiting ocfl.net/crime survey. Again, ocfl.net/crime survey if you want to give your input into the crime-related responses and strategies to be developed. And with that, I'm going to turn it over to Dr. Pino, and we'll go from there. Also, we do have City Commissioner Regina Hill here from the City of Orlando. So welcome, Commissioner.
Good afternoon, everyone. Thank you, Mayor. Thank you, everyone. So as the Mayor mentioned, we overpassed 100,000 infected individuals from the pandemic, but we also are getting to 100,000 vaccinated individuals in the county. So that's rising rapidly. Just to give you an idea, about 5%, actually 5.4% of our population has at least received one of the dosage for the vaccine. And we were anxious to pass the 5% so that we can get to 10%, and then 20, and then 30, and the other percents that we want to get at. With regard to the vaccination, the site continued to operate smoothly. We have increased our daily appointment to 2,500 to compensate for some cancellations. Our output is about, when it gets to the high point, is about 300 cars an hour. We average about 200 cars an hour. We are open from 8 o'clock. Sometimes if we are ready, we open by 7:30, but the official opening time is at 8 o'clock, although the line sometimes starts at 6. And then we close our last appointment at 9 o'clock. We give it a little time. If we have a line, we wait. But if at 9:15 we don't have any appointments waiting, we close the door so that it gives time for us to sanitize everything and get ready for the next day. Our staff leave around 10 o'clock at night, at 10 p.m. We also want to encourage people to cancel your appointments if you are not going to use it. As the portal remains open for that week, any cancellations will open up that appointment, and coincidentally, someone who may come may find an appointment. The mayor also mentioned, and I think that's a great idea, anyone who wants really to pre-register for the appointments should go and do it, because then at the time of making the appointment tomorrow at 8 o'clock, it will be just clicking and making the appointment. A lot of times goes into entering your information, putting your details, and that will save you that time and you quickly can reach that appointment. Also, as the mayor mentioned, we are opening in the morning and not in the afternoon like we normally have done, to give seniors the opportunity to have access to the different centers that are going to open to offering that help to get registered. So the vaccines is all moving in the right direction. We also going to probably, we are exploring the possibility of increasing our vaccine output, and we are exploring different possibilities. We have sufficient inventory right now that we could expand a little bit more, if not permanently, at least every other week, every 2 weeks, depending on the cycles and the number of vaccines that we may receive. Additionally, the state have said that it could be an increase in the allocation of vaccines from the federal government, and that probably will trickle down to us as well. So that's what we are getting ready for. On the sad news, the mayor mentioned to you that we have reached 937 individuals who have died from this disease in our county, and all those 242 additional deaths occurred in the month of January. And now, because this was expected, it doesn't change the fact that it's a very sad and tragic number for our community. 23 of those individuals were female, 19 were male, 4 were Asian, 7 were black, 4 were other, and 27 were white. 17 were Hispanic origin, and 25 were non-Hispanic. 33 had underlying conditions. 9 did not. We do not know if they had it. And the average 9 of the 42 individuals were from assisting and living facilities. With regard to the variants of the virus that has been circulated around the world, and we have received questions from some of you regarding if this was in the county. First, a couple of weeks ago, someone asked me if we were doing anything to detect this variant, and my answer was no. I was wrong. I was quickly corrected by my staff that we are working with the CDC in detailed trace investigation for those individuals who may be suspected from coming from an area we've had incidents of those variants. So let me rectify the answer. We are working with the CDC to identify those cases. On that work, 2 cases were identified that the tests occur in our county, but they are not county residents. That is not to say the variant must be out there, because it's everywhere. but we don't have any concrete evidence that is in a county resident at this point. We have not detected. It doesn't mean that it's not there. Those two individuals were from Broward County and from Osceola County. Seminole. I always get Osceola and Seminole mixed up. I have to learn that one. I also want to comment on the individuals that have registered for the portal that are not residents of the state of Florida. For those appointments that already happened, we are going to honor the second dosage. It will not be fair to those individuals, no matter where you are from. For those who have an appointment in the future that are not residents of the state of Florida, the system is going to send an email asking those individuals to either cancel their appointment if they are not residents of Florida, or to be ready to provide proof that they are at least a part-time resident of the state of Florida. We also want to encourage everyone to continue to wear your mask, wash your distance, and wash your hands. The data is all going in the right direction. Positivity rate is declining slowly. We have seen a decline in positivity rate in younger than 17. In the last few days, I couldn't check today, but I think that continued to be the case. We have seen decline in hospitalization, ICU bed use, ER visit, and individual on ventilators. And so the data is starting to show signs of recovery. It is important more than ever not to get your guard down, not even because we have the vaccine. Remember, the vaccines continue to be limited and only for specific groups in our population, so we have to continue to protect each other. With regard to the doses, 21 versus 28 days, we continue to get this question. It is okay to get the vaccine beyond the 21 days and beyond the 28 days. We try to make it as close as possible to that optimal day, but it can even be taken 4 days before those days, if it happens to be. There is no limit in the upper frame, although we try to keep it within the 28 days. It's also new evidence, new information released by the CDC that in the event that you may receive a different dosage on the second and the first time, meaning Moderna versus Pfizer or vice versa, it is nothing to do about it. You don't have to restart your series. You will get your immunity, and it is nothing to be done about it. We will try and make every single effort, and everyone is, to provide you with the same vaccine that you get the first time, and so far that is the case. But in the case that were to happen, it is okay. You don't have to restart the series. You don't have to worry about any damage or consequences to your health. With that, I will answer any questions that you may have. Thank you. Mayor?
All right, thank you, Dr. Pino. Just as a reminder, if there's any Spanish-speaking media, we have the ability to do translation. Ms. Ilia Torres will assist with that. And we also have from the school district, Mr. Scott Howard, who's here if there are any specific questions related to the schools. And with that, we'll open it up for questions at this time. So, Ms. Lauren Seabrook.
Thank you, Mayor. Lauren Seabrook, Channel 9. My question's for you, Dr. Pino. Do you know about how far we are through the 65 and up community in Orange County and how close we might be into moving to maybe the second tier?
I don't. I actually had a conversation today with the Surgeon General in the morning, and we were talking that we may need to explore the data specifically in that age group and isolate others so that we can explore if the vaccine is starting to make a difference and how far are we. So that's part of the things that we are trying to do next. But again, and people have to understand it's a very large body of data. It takes a lot of time to get it ready. Right now it's in the millions of entries in, horizontally and vertically has an infinite number of variants. So it's a complicated data set, but those analyses, yes, need to be done. We need to know how far are we to also get ready for the next group. But I don't know when that's going to happen. I think that we still have a large number of healthcare providers that have not been vaccinated. And our population in Orange County over 65 years old is over 200,000. And we have only vaccinated close to 98,000 individuals in total dosage given in the county. So we have a long way to go.
Amanda Dukes from Channel 2. My question is for Dr. Pino. The appointments that will open tomorrow, how many appointments, who are they for, and any tips for people who are trying to get an appointment who've struggled?
So appointments, I don't know how many per day, but it's going to go up to 2,500. Because each day we have different number of appointments. So it could be that in a day we are adding 300. It could be that in a day we are adding 250. So that's why I cannot tell you how many per day. But last time that we opened it, which was similar to the coming weeks, we added about 8,000 appointments in that week. So the numbers should be very close to a little bit over 8,000. It's also important that people do not come without an appointment. When you, although we have several filters through the line, it could happen that someone squeezes in. Do not come without an appointment. It really slows down the entire process. A vehicle can bring the entire operation to a halt because the way that it's designed. That's why we have those filters at the beginning, because when you get into the convention center, if a vehicle doesn't have an appointment, it just slows the entire thing down. First, we have to argue with the person who wants to have the appointment, which we understand. And the second part is that then we have to take that vehicle out of the line, and it holds everything back. And why we do that? It's not that we don't want to give you the vaccine. It's that the vaccines are carefully drawn every day based on the number of appointments that we have. One appointment will not hurt the drawing of the vaccine, but we don't have control how many people may come without appointments. And that will alter the balance of things in there. For the people who are having difficulty getting this appointment, I think the mayor explained all the resources that have been put in place to be able to help seniors that may not have access to the internet or may have difficulty using the technology. But I've been surprised for how many neighbors have driving other people to the site, and how many people are calling to help other people, and how many wife and husband were not able to get it the same day, but they come together just to support each other on the second. It has been a pleasant experience overall.
Hey, this is for Dr. Pino. It's Samantha Sosa with Fox 35. The HHS number, say Florida is getting an additional around 40,000 vaccines. Do you know how many will be allocated to Orange County in particular? You said that you guys are getting ready for that increase. What are you also doing to get ready?
So ready for that increase is having the refrigeration capacity that we need to keep it at the temperature that needs to be kept. Getting ready for that is planning in the possibility of opening an additional pod, if possible, and we get the volume. That probably will not be a pod as large as this or as long as this one. It may open every time that we have an additional level of vaccines accumulated. So all we do is planning and prepare for those circumstances that may arise. But it's also how you are going to register those individuals, how you are going to provide the information, and how the data is going to be entered and collected. Again, giving the vaccine itself is the simplest of all. It's just boom, boom, gone. It's what goes after or before that complicates the process.
Do you know how many?
No, I don't know how many. Vaccine allocations in Florida are done based on population levels. So we are the 7th largest county in the state. So proportionally to that, we should be getting an increase.
Okay, this is Melissa Thomas of Florida National News. This question is for Mayor Demings. Just want to get your personal thoughts, Mayor. We got the recent news of the Pentagon getting the request for that broader distribution of the vaccine on kind of a federal level using military forces. Just wanted to get your thoughts on that, what your expectations are, particularly here in Orange County, and with regards to military coming in to kind of help with that distribution.
Well, that remains to be seen. Our county, it's a large county, and we have gone through great lengths to try to coordinate within our county to be able to meet the needs. And so the decision about where the military resources will actually be deployed has not been determined at this point. But if we are able to receive a significant increase in the supply of vaccine within our county with resources to help distribute it, I think that's a good thing for the residents of our county to be able to do that. So we look forward to more clarity and more official information as that develops.
This is Sharon Stone with News 13. Question for Dr. Pino. You were talking about the variant cases and said there's no concrete evidence of it happening in Orange County. What would you say to people, though, that continue to hear about these variants spreading? Like, are you concerned that it's going to come here?
Yes, concerned in the sense that we need to accelerate vaccination. And we need to immunize as many people as possible before this virus continues to mutate. Right now, the pharmaceutical companies are analyzing, and the evidence suggests that the vaccines continue to be effective as it is right now. Although not only we have now the UK variants, we also have the South Africa and then Brazil, and who knows what else could pop. So anyone who have access to the vaccine and have the opportunity should get vaccinated. The concern is that it could continue to mutate, and some of the mutations could bring resistance, and that's always a concern.
Hi, my name is Michelle, and I'm from Telemundo 31. My question is for Dr. Pino. I know you talk about the vaccine, the people do not live here in the county. Can you repeat that for us in Spanish?
Sí, lo que yo estaba diciendo es que las vacunas están planeadas para las personas que viven en el estado de la Florida. Y esos, incluso personas que tal vez no tengan la licencia, pero tienen la tarjeta consular de los diferentes países de los cuales nosotros venimos, se considera que residen en el estado de Florida y no tienen que presentar ningún otro documento. So, con la tarjeta consular o el pasaporte que acredita que tú vives en el estado de la Florida, está bien para presentarlo como documentos de identidad. La situación está que ha habido un grupo de personas que no son residentes de la Florida que se han registrado y después de que el gobernador dio la orden de que solamente los residentes de la Florida deberían vacunarse, y eso incluye también las personas que residen part-time. Por ejemplo, tal vez haya alguien en Puerto Rico que va y viene entre los dos estados, y entonces, pues, si se considera que la persona vive acá part-time, está absolutamente justificado que se le dé la vacuna.
This is Steve Hudak from the Orlando Sentinel. This is for Dr. Pino. It's regards to the variant. You had mentioned that the two instances were people who did not live in this county. Are they tourism related, or have you been able to trace where they may have come from?
I don't have all that information. The recent case was actually today, just after you sent that email asking for those. So it was like, okay, it just happened. Really, it just can't tell you. It happened a few minutes. You send the email asking for the variant, and we got information. Oh, we may have one. So that was today. I don't have all the information, and I apologize for that. We have been working at the site, so that we have not been in the office as much as we should. to be able to get all these levels of information.
I have two questions this afternoon. The first is for Dr. Pino, coming from Asher with Channel 13, News 13. Dr. Pino, since the vaccine has started to be administered to senior citizens, has their positive cases gone up or down?
The cases are going down in general. I cannot say that it's just attributable to the vaccine. I think that it's also in part that we are moving away from the hump from the holidays and the overlapping holidays, and in part is the natural evolution of the pandemic, and we have seen this before. We go down, we relax, we get comfortable, we have a couple of holidays, we travel, we get together, it goes up again. And that's the things that we would like to prevent.
And I have one more also for Dr. Pino, coming from Ryan Lynch with the Orlando Business Journal. What would be the biggest factor in helping to ramp up vaccination? Would it come down to increased vaccine supply or other factors?
Vaccine supply would be the main factor, as the mayor mentioned. And, I said this many times before, and I'm not doing lip service. The administration here in this county, every single institution has been critical to the success that we have. The leadership, the support, economically, with personal and otherwise. I'm telling you, the other day we have a little issue at the convention center where all our nurses that were contractors were pulled by the contractor, and that was at 9 p.m. on Monday. 9 p.m. as we were closing the event, we got a notification that we will have no nurses the next day, because we were using strike team nurses from the state that were assigned to another mission, and we didn't get it, not noticed. We called the fire department, we called the mayor, we called everyone. Our community did not feel at all that we have that issue the day before. It just, we called for 10 firefighters, they show up. We called for additional resources, we got it. And no one felt anything. We could have been that shoe that I was always waiting for it to drop. That could have been that shoe. So vaccine is the main limiting factor right now, vaccine inventory. Now, we have built some inventory, and we don't want to have vaccine in storage. So that's why we are constantly planning to have other venues to be able to provide those vaccines. But as the mayor mentioned, also the strike team with the Orange County Fire Department and other municipalities will increase the visibility and the number of cases that they are doing. It's always a smaller and a slower operation because it's door-to-door, serving people who may not have the mobility to go to the event.
Thank you. That's all. Thank you.
Okay. Well, hopefully this has been informative for you. Our next scheduled briefing will be Monday, February the 1st at 4:30 p.m. Thank you all for coming and participating today.